COVID-19 is in our communities and the number of cases is on the rise. So it's essential that we each play our part in full by following all of the government guidance. Only by doing this can we keep our schools and businesses open. If you're young and healthy, you may feel the virus isn't a threat to you. But someone more vulnerable to coronavirus than you, perhaps someone closer to you than you realise, is depending on you to play your part in breaking the chain of transmission. So I'm asking everyone to do their bit. Stick to the rule of 6 for gatherings indoors or outdoors. Wash your hands thoroughly and regularly. Wear a face covering in enclosed spaces. Observe social distancing of 2 metres or 1 metre plus precautions where 2 metres really isn't possible. Follow all of the guidelines about car sharing. If you have symptoms, self-isolate and get a free test immediately. If we work together on this, we can control the spread of the virus. Thank you.
Yeah, okay, thank you. We are now live. Good morning, everybody, and good morning to anybody who's listening to live. Welcome to this COVID 3 R's committee, which, as you know, is being held remotely. For the benefit of viewers of the live stream, I'll now ask Keith just to tell us who is present and who has handed in their apologies.
Thank you, Chair. So in terms of members, we have Councillor Reg Adair, Councillor Joyce Bosnia, Councillor Ben Bradley is joining the meeting. I don't think he's actually in it as yet. Councillor Mrs Cutts, Councillor Stephen Garner, Councillor Rachel Madden, and Councillor Michael Payne and Councillor Alan Rhodes. Councillor Rachel Madden is attending for Councillor Jason Zazdrozny. And in terms of officers, we have on the call Anthony May, the Chief Executive, Corporate Director Adrian Smith, Service Director Derek Higton, Director of Public Health Jonathan Gribben, Service Director Matthew Neal, and Group Manager Nicola McCoy-Brown. Thank you very much.
So thank you, Keith. Just to go through the preamble before we get into the main report. So can I accept the minutes as a true, accurate record from July? That's the 16th of July. There's no there. Thank you very much, Reg. As we say, apologies for absence. We've just got Keith. Is it Rachel Madden for Councillor Zazdrozny?
That's right. Yes, that's the only substitute we've been sent. And as I've mentioned, Councillor Bradley is on his way, I think. So.
Yeah, he's just texted me. He will be about 10 minutes late to the meeting. Declarations of interest. Any members got any pecuniary or disclosable interest to declare? I take that as a no. Thank you. And nobody with any private interest? No, thank you very much. So on to the main agenda item on your pack, that's number 4. I'm going to introduce this item and hand it over to Jonathan Gribben to introduce the report. Jonathan, are you there?
I'm here, yep, ready.
Thank you. If you can give this report then, please.
So, good morning, councillors. The report does a bit of backward looking as well as some forward looking. It reports on local outbreak management arrangements over the last month or two, which we spent quite a bit of time focusing action around containing the outbreak in Newark. And the report summarises that and also brings to you a summary of the report from the number 10 task force field visit that we received towards the end of the month. And that was very positive. But the situation moves on quite quickly. So if I was to refer to the situation as it is now, things have moved on somewhat. Whereas a month or so ago, across all our districts and boroughs at that time, all of them would have seen incidence rates of less than 20 per 100,000, with the possible exception of Newark while we were dealing with the peak of the outbreak there. Now we have only one district in Nottinghamshire with a rate of less than 20 per 100,000. And in fact, we have 3 as of yesterday with rates of just over 40 per 100,000. Whereas previously we had largely single outbreaks like the one in Newark that we were able to deal with on a serial basis, one after another. Now we find that we've got multiple incidents that we're dealing with concurrently. Previously, and I'm happy to say we've seen none of this has been reflected in NHS activity. As of last week, we're now just starting to see what may be the very earliest signs of an increase in NHS activity associated with these cases, although that in particular is too early to call a trend. And all of that really leads into what the report also touches on around second wave. At paragraph 20, it comments that the scale and timing of a second wave remains unclear. Whereas this isn't something that's going to receive some sort of national announcement, but I think the indications are that from what I've just been describing, that what we're now moving into a different phase where rates are generally rising and much higher than they were. So councillors will be keen to understand something of our readiness and some of the work we've been doing around preparations for second wave. And the paper also comments on what went through Adult Social Care Public Health Committee yesterday in terms of approval for how we will implement and use the Health Protection No. 3 regulations. So these are some of the new powers newly vested in the local authority to contain outbreaks locally. You will also want to know that yesterday committee also gave approval to some funding for some fixed term posts and some other specialist roles that will be hosted elsewhere within the local system, which together will form some of the resource which will enable us to sustain outbreak control over the next year or so. The paper you have in front of you also touches on some arrangements we're making around contact tracing to take on more of that locally, and I think that will potentially increase the effectiveness of some of the contact tracing which is currently undertaken at a national level. And then finally, the paper also sets out information around seasonal flu planning. So although this is not, we might ordinarily think of this as something very separate from COVID-19 in the context of planning for winter and keeping our businesses and schools open and ensuring that the health and social care system doesn't become overwhelmed, making sure that we've got really good arrangements in place for limiting the impact of seasonal flu is extremely important. And the paper also sets out some of the arrangements that we're putting in place as an organisation to ensure that. Thank you, Chair. That was as much as I was going to say by way of introduction.
No, well, thank you very much, Jonathan. Before I open it up for members' questions or comments, I'm just going to formally move the recommendation, which I think is on page 12 of your agenda. Do I have a seconder for that, please?
Yeah, I second that and reserve the right.
Thank you, Reg. So now I'm going to open it up for your views, comments, questions. Anybody got any questions or comments they want to make? No? Michael, sorry. Yeah, Mike.
Thank you, Chair, and thanks to Jonathan for the report and the hard work that's going on. I just wanted to draw on 2 comments, if I may, Chair. The comments made by the Director of Public Health in relation to contact tracing, and of course the welcome announcement around additional work that's going to take place at a local level, which I noted the Director of Public Health said should improve things. Can we conclude from that he's got concerns about the way that contact tracing is being arranged at a national level? Just some more information about your views on that as our Director of Public Health, Jonathan, would be welcome. The other thing that I was somewhat surprised about, and I'm sure Jonathan can elucidate for us further to the information in the report, is the almost silence in this report on the issue around testing, which has obviously over the weekend received much media attention around capacity for testing. And I'd just like Jonathan to shed some light, if you may, Jonathan, on testing capacity, the knowledge that you have of testing capacity in our county and locality. And what situation residents in Nottingham, in line with what you've reported around a slight uptick in incidents in certain localities, what capacity there is for Nottinghamshire residents to be tested in the locality, or whether they're having to travel further afield, as we've been reading in the press over the weekend. And then the final bit, Chair, if I may, is whether Jonathan could just give us some assurance about reports that many of us will have been reading over the weekend about care homes in the locality, which clearly is deeply worrying when we're talking about our most vulnerable residents in some of our care homes. Thank you, Chair. Thank you, Jonathan.
Thank you. Before Alan, I have seen you, and Joyce, you've also indicated. So, Jonathan, I'll let you go first, and then come back to Alan, and then Joyce. So we'll ask separate questions. So, Jonathan, do you want to deal with those points from Michael, please?
Yeah, thank you, Councillor. So, in terms of the contact tracing, I think probably my overall comment would be that for any aspect of the response to COVID-19, which we're going to have to sustain over the next year or so, I'd be interested in making sure that we continuously improve the arrangements we've got as a system. And we do know from what other local areas have done, authorities as close as Leicester and some further afield, that when local authorities are given responsibility for some aspects of the contact tracing, they're able to deliver something that's more effective than through the nationally commissioned arrangement. So that's something that I am looking forward to securing for Nottinghamshire residents. In terms of testing, you're quite right. I also know of instances, and I cannot quantify them for you, but I think it's happening quite frequently, where some of our residents with symptoms are seeking appointments to get a test, and the only test that they can get access to within a short and reasonable space of time requires them to travel some considerable distance. So that is a concern to me, because we want all of our residents who have symptoms to seek a test really promptly and to get a result, so they've got some clarity about how long they need to isolate for. The information that I have from the Department of Health and Social Care, who run the nationally commissioned testing arrangements, is that the current problems that our residents experience, the root cause of those is a shortage in lab capacity, and that there are things in place to resolve that, and that significant increase in capacity will come on stream over the next few weeks. But my expectation is that this isn't a problem, therefore, that's going to be resolved in the next few days. So in the meantime, there are a couple of really important messages that we want to be able to get out and promote. First of all, in mitigating the impact of the problem, we do want to emphasise to our residents that national test and trace system, the testing bit of it, is designed for people who have symptoms. We do know nationally that a lot of people are coming forward who are asymptomatic. They may be coming forward for all sorts of reasons, but what we need to make sure that we promote really consistently is that people with symptoms come forward for a test, but not people who are asymptomatic. If you're asymptomatic, you're actually taking away a test from someone who really needs it. The other thing I'd want to promote, re-emphasise around this is that if you have symptoms, irrespective of whether you've received a result to a test yet, you need to be self-isolating, and that's the step which enables us to stop the spread. Finally, you asked about our care homes and made reference, I think, to some information that was in the media over the weekend. We have really good arrangements in place for managing COVID-19 in our care homes across the county, and because of that, we probably have more up-to-date and more complete information than might be available in some areas of the country. So I can tell you that as of Monday, we had 14 situations in care homes across Nottinghamshire County that we were managing as outbreaks. Now, each of those came to light through the routine testing that is undertaken in those care homes on staff and residents. And as a result of results coming through from those, the situations in those care homes will have been informed to Public Health England and also to our local infection and control specialists who work in our local NHS system, with whom the care homes work very closely to ensure that those situations are managed. Thank you.
Mike, is that okay?
Yes, fantastic. Thank you very much, Jonathan, for the comprehensive detail.
Thank you, Jonathan. Alan, I'll come to you, and then Joyce, you're the only other person that's indicated. Alan, do you want to ask your question or make a comment first?
Yes, thank you. Well, first of all, can I thank Jonathan and Anthony for the regular briefings that we've been receiving as recently as yesterday. They're all very informative, very helpful, and we're grateful for the time that Jonathan and Anthony afford us in during their very busy diaries. I just want to make a couple of comments, really, and it really it occurred to me when I read paragraph 9 about the outbreak in Newark recently. That was very troubling and very worrying at the time, and I know some good work has been done to tackle that. But it struck me that actually joint working with the districts and borough partners has been key to tackling these local outbreaks, and Nottinghamshire would have been mentioned several times actually in the report, and it seems to me that this joint working between ourselves and our district and borough council colleagues is really important and key to tackling these local outbreaks. And secondly, it seems clear to me, and Jonathan may or may not agree, that one size doesn't fit all here, and that local factors and a local response based on local intelligence, I guess, are the best ways of tackling these outbreaks. That's it, really. Thank you.
Okay, have you got any comment on that, Jonathan?
The number 10 task force field visit also found that in Nottinghamshire we have what they call very robust partnership working right across the local resilience forum, and that extends not only to districts and boroughs, but right across Public Health England and our local NHS colleagues and other agencies as well.
Yeah, and just taking that further, I mean, before I bring you in, Joyce, I don't know if members have been aware, there's been a narrative, I think, that's been building up about university students in some way being super spreaders almost. I think it's a bit disingenuous. In terms of Nottinghamshire, I've been incredibly impressed by the way that the university, both Trent and the Nottingham University, have put in recovery planning. I think, Adrian, you've been dealing with the city universities, have you, with the two universities? Do you just want to make some comments on what we've been doing with those as well?
Thank you, Chair. Yes, happily. So through the LRF Resilience Forum, we've been working alongside both Nottingham University and Nottingham Trent University to look at how the universities can reopen their campuses in a COVID secure way. And firstly, it's been very impressive the degree to which two universities have worked together and the way they've worked with local partners, including the councils. And helpfully, of course, our universities have campuses in other parts of the world where they've learned lessons, particularly Nottingham University learning lessons through the reopening of their China campus. I think Nottingham University were also one of the first to reopen a campus with the return of their vet school earlier in the year. And so those lessons have been shared and recycled to try and help prepare for the return of students on a whole scale later this month. So there's a number of things been happening through a kind of task and finish group that's been working within the LRF structure, looking at health and safety measures that can be put in place both on campus and in neighbouring areas to keep both students and the wider community safe. There's been a lot of communication going out to students in anticipation of their return, setting out the expectations the universities and partners have around behaviour, and also the kinds of sanctions that can be taken should they not adhere to those standards. and some comprehensive plans, both around testing and outbreak management in a range of different settings, whether that's on campus or in other housing settings that students occupy, predominantly in the city, but we're very mindful that that bleeds out into other parts of the county as well. So we're grateful for the work universities have done through the LRF and for the way that they've kept us and other partners informed, and we hope that the return of students to our patch can go as smoothly as possible. Thanks, Chair.
Yeah, that's great. Thank you very much for that, Adrian. Joyce, I've got you, and then Kay, you indicated as well. So Joyce.
Fine. Just a comment first I'd like to make, and that's about looking for local solutions to problems, particularly around testing and track and trace. Because I am still aware that certainly school children are being sent home because they've got colds or they're poorly, and the teacher or whoever has advised them to go home and get a test. And obviously that's just not available, and that's causing a lot of stress. So any kind of local solution that deals with that kind of anxiety, I think will be good. But my question is more to do with the Summit building, which is the construction site, the Amazon construction site in Ashfield. And I'm all COVID out myself because I've already asked you this question before, Jonathan. But for me, it's important that we try and analyse and learn from each experience that we have. So, for instance, although it's in Ashfield, I'm well aware that there's people from Mansfield and further afield who live further afield that still work there at the construction site. So I wonder whether we're trying to find out more about their circumstances, about do they travel every day? Is that where the possible risk is because they're travelling? And also, when we looked at what was happening in Newark and what was happening in Bassetlaw as well, what have we learned from that? Have we analysed what we did and what we did was right? And has there been any similarities? I'm all for learning from every time we tackle an issue to try and look for the signs before they start to get out of hand. So that's my question. Thank you.
Thanks, Joyce. Jonathan?
Thank you. In terms of children being sent home from school, there are probably a couple of issues in there. I'm forming the impression on the basis of several reports coming through to me that there are some inconsistencies in how schools on an individual basis are managing children they perceive to be unwell. So I'm involved with my team in making sure, again, that schools have all the correct and up-to-date guidance, because it's quite clearly set out on the .gov.uk website, the circumstances in which a child should be sent home for reasons related to coronavirus. In terms of learning, yes, it's absolutely critical, isn't it, that we learn not only within Nottinghamshire County from how we've got on in managing different incidents and outbreaks, but also across the region and nationally. So we've had a number of things in place. We've run some exercises locally, going back to the end of July now, which were very helpful in terms of learning and understanding the bits of our plans at that stage that needed strengthening and tightening up. We also reflect at the end. We have a debrief at the end of each of the incidents or outbreaks as we stand them down to capture the learning from that. And it's partly the learning that we got from Bassetlaw, which helped inform some aspects of what we undertook in Newark. For example, some of the ways in which we engaged with the one of the businesses involved there about the value and how we might go about approaching whole workplace testing, for example. We'd also learnt by that stage quite a bit about how people travel to work from outlying areas, the extent of car sharing, and also amongst some groups of employees, the fact that they live in houses of multiple occupation, so are subject to different kinds of risks and hazards associated with those settings as well. So all of that has helped to shape the way that we contain things in Newark, and that in turn then helps inform what we're doing in at Summit Park, where some of those factors also come into play there too. But I think you'd want also to be assured that we're not just looking within our borders, but are connected regionally and nationally as well. And working through the regional convener for Contain, who up until recently was a colleague, Dr. Peter Marks, and also through the network of East Midlands Directors of Public Health. I keep in touch with my counterparts about the learning they're getting from managing some of these different types of incidents and picking up some of the common themes, and also through the regional convener have access to some of the learning that's coming out nationally as well. I think, and I hope I've addressed both your questions there.
Thank you, Jonathan. Thank you, Joyce. Kay, you're the last person who's indicated.
Thank you very much, Chairman. Well, mine was really around the number 10 task force visit to Newark. I had assumed that this was some sort of inspection, but I think it was also partly learning, because I was told by the team when I was interviewed that they'd also visited Milton Keynes and Lincolnshire and other places across the country, and that they had also interviewed the businesses in Newark Market, because it was quite a handy place for them to be so close to the outbreak. And the thing that came out of that was worrying about what's going to happen about Christmas, which is trivial to start with. But of course, these businesses rely upon Christmas as one of their big incomes of the year. And unless they get their ordering right, they stand to lose an awful lot of money. And bizarrely, turkeys was one of the things that came up. And the size of turkey you're going to order, if you're a family of, let's say, 4 or 6, you want a smaller turkey than if you're all getting together for a family of 15 or 20. And it sounded a bit silly at the time, but of course that then found its way into the weekend papers. And that does make a lot of difference to quite a lot of the chains in the industry, actually. How big a turkey do you grow if you're a grower? How big a turkey do you order if you're working in that meat market? And how does that affect the household? So it is part of the economy of the county. And I was interested to see, and I also asked them the questions, are we doing as well as other people? And they came back and they said to me they thought we were doing better than many other people, that we had really got a grip on what we were trying to do. And I do put this down to having had the experience of the Ashfield outbreak, the Bassetlaw outbreak to start with, and some of the learning curves we took from that. So I think this council came out of that, shall I put it, inspection quite well. But we also contributed, I think, to the national debate about this. And, you know, it is difficult for all of us. I think I must be among many people where I expected by now the virus to have gone away. Clearly it's not, and it's changing its where it's affecting people. But so long as we keep resilient, I think, as a county, and continue with the learning which Jonathan's pointed out, and keep in close contact with the other public health leaders around the country, I think we've got a good chance of being as good as anywhere. And all we can do is keep trying our very best. So, Jonathan, I'd like to say thank you very much. I know how worrying the time this has been, but I am deeply grateful to you. Thank you. Thank you, John.
No, thank you, Kay. I think we all echo those sentiments. Jonathan, I'm not sure if you want to comment on turkey sizing, do you?
You never vote for Christmas. That's one thing about turkeys.
I look forward to the 25th December.
Okay, thank you very much for that, everybody.
No, sorry, I haven't got a hand to put up on this this device.
Where are you, Ben? Sorry, I beg your pardon. Ben, would you like to?
Yeah, I just had a very brief question. I wondered if Jonathan or it might be somebody else who's more suited to go through, but just to explain from my own interest, kind of how this works in terms of how you feed that back into government, because obviously we're on a national level trying to make decisions about things like Christmas and what we do and what restrictions may or may not be in place, etc. What level of feedback are you able to give, and is it something you think is an effective system at the minute?
Chair, shall I?
Yeah.
I know that what I can say would, I think, probably be supplemented by what the chief executive himself might, some of the channels he has. But in terms of the channels that I'm using, I took a call this morning from Public Health England, who were wanting to understand the latest situation across Nottinghamshire, and part of in that conversation, they are also asking, and what could be done nationally, which would make the situation in Nottinghamshire easier. So that is one forum through which I'm able to feed things in. That's through Public Health England. Secondly, I mentioned this strange sounding role, the role of the regional convener of the Contain programme, which is he has a very small team that covers the East Midlands, but I'm in regular touch with him as well, and that also provides a channel through which I and my counterparts in other local authorities can feed in requests about things that we would like to see more of or done differently at a national level as well. And it may well be that, well, I know that Anthony has his own channels as well that he's able to use for some of this.
Thank you. I mean, it's an important question, actually, Ben, and it is important that we spread best practice throughout the United Kingdom. Anthony, perhaps you might be able to elucidate a bit more on that. Have you got anything to add to what Jonathan's just said?
Yeah, thank you, Chair. Good morning, members of the committee. So each English region has nominated a lead upper tier chief executive to coordinate across the region responses to COVID-19 and also to feed back to government and escalate any areas of concern. The nine chief execs meet every week with a senior official from MHCLG, and Catherine Francis, the Director General, brings in senior officials from other departments across government, whether it's Treasury or DEFRA or the Department for Education or the Department for Health and Social Care, most regularly. And we have the opportunity to talk to them about issues that are affecting local areas. During the height of the pandemic, in the first wave at least, those meetings were sometimes daily and very often across weekends and late into the evening, as government actively sought feedback from local areas. And I think that was a helpful and dynamic process. Those meetings are structured in a way where local authorities are able to feed into their regional lead chief executive, and I hold a fortnightly meeting of all the upper tier chief execs in the region and a fortnightly meeting of all chief executives in the region, and we use that as a conduit to feed up to government any issues that are arising across the East Midlands or in any local area. And in between those meetings, there are work streams and there's a constant flow of information between local areas and civil service colleagues. At the same time, there are regular webinar sessions hosted by ministers and secretaries of state. There's one today, actually, to feedback on the Mary Nay review of learning from Leicester and Leicestershire. And either the leader or I or another senior officer will engage with those webinars and feed in any issues from the County Council. At the same time, I chair the Association of County Chief Executives, and we have a regular meeting again in the heat of the pandemic. That was twice a week, now it's once every fortnight, where we've got separate channels to feed up concerns that are county specific through to MHCLG and across other parts of government, Chair.
Thank you, that's really good. Did that clarify things for you there, Ben?
Yeah, thanks. I guess the one word almost follow-up question is, do you think, Anthony, that's an effective system? Is it too much, too bureaucratic, or are you happy with the way that that works?
So through you, Chair, my view is it's been an effective means of maintaining a dialogue with government. Has it resulted in perfect solutions to the problems every time? No, it hasn't. The pandemic is very fast moving and has required everybody in either central government or local government to work in ways that require new thinking, new types of solutions to problems that we haven't seen before. And indeed, we've already heard from Jonathan today that there are still some outstanding issues that we need to resolve. What I'm confident of is that the people that I deal with in the civil service represent the government's point of view, honest with us about the things that are possible and the things that are very challenging for them. And they've got an open and a can-do attitude to try and make things better. So from a communications perspective and a cultural perspective, in other words, engendering a sense that we're all in this together, I couldn't fault it. However, there are still many challenges that we need to resolve.
Thank you very much. I think we've given this agenda item a good run through. Thank you for your questions, colleagues, and thank you, Jonathan, for answering them, and Anthony. I'm going to move on to the vote now, which is the recommendation. I'll read it out verbatim, that the committee considers the contents of the report and identifies any possible measures to recommend to the Nottinghamshire County COVID-19 Engagement Board. As you know, with these live meetings, I wouldn't normally ask you individually for your vote, but we are going to take a vote in alphabetical order. I think, Keith, are you taking over from here? Keith?
Sorry, Chair. Sorry. Yes, I can just take the vote now. So just to underline, members, as with other meetings, this isn't a formal recorded vote that'll appear in the minutes of the meeting. But if any members, two or more members request that, we can obviously turn it into a recorded vote. So I'm just going to take the roll call now. So starting with Councillor Regidare.
4.
Councillor Joyce Bosniak.
4.
Councillor Ben Bradley.
4.
Councillor Mrs. Kay Cutts.
4.
Councillor Stephen Garner.
4.
Councillor John Knight.
4.
Councillor Rachel Madden. Councillor Madden, are you there? Yes, thank you. Councillor Michael Payne.
4.
And Councillor Alan Rhodes.
4.
Thank you. So that's unanimously agreed, Chair.
Thank you very much. Thank you, Keith. So we're going on to number 5 now, which begins at page 13 in your report. This is an update report. I'm going to introduce this item and then I'm going to hand it over to Derek. Derek, would you like to take this over?
Thank you, Chair. Yes, so this report summarises the County Council's response and recovery in areas of our service provision and corporate response that aren't covered elsewhere on the agenda under items 4 and 6 today, notably. Members will be aware that it's the latest in a continuing series of reports that we brought to committee throughout the pandemic, beginning with reports to Policy Committee when that reconvened earlier in the spring, and it covers the key areas of the County Council's provision across Nottinghamshire, including children's and our schools response, adults services, and our range of place services as well, including the community hub and our associated elements of our community response. You'll see from the report that most of the County Council services, particularly those that are most well used by members of the public and residents, are now either fully or partly operational, which is really good news. And the report also provides a high-level financial summary, both in terms of the financial impact of COVID on the council and the ways in which we're dealing with that financial impact. As ever, either myself or other colleagues on the call are happy to take questions that members might have.
Muted, Chair.
Still muted.
Beg your pardon. So I'm going to formally move it and ask for it to be formally seconded before I open it up to the floor. Reg?
I second the report and reserve the right to speak.
Okay, so questions and comments, please, from members. I've got Alan and then Joyce.
Thank you. Yes, I've got 2 or 3 questions and a comment to make. So on paragraph 9, page 14, resetting and rethinking health and care services, I had a very good briefing, very interesting briefing from Melanie Brooks the other day. She's very impressive, and I was very pleased to hear some of the things that she had to tell us, and there's clearly some forward thinking going on in the way that we continue to offer a good service to our most vulnerable residents. Over the page, well, page 16, a couple of pages, paragraph 19, well, the A-level GCSE and BTEC farce was just that, really. It was a total shambles, which in my opinion, Gavin Williamson should have done the honourable thing and resigned. And it's quite clear that standards of ministerial competence and accountability are at an all-time low at the moment. A question, if I may, on paragraph 21. We're told that during the pandemic, we've seen a reduction in inquiries to the multi-agency safeguarding hub from schools and subsequent child and family assessments. I don't suppose we should be too surprised at that, since very few children, by comparison, were in school at that time. But we haven't been given any information about inquiries or referrals from other places and whether we've experienced an increase overall. We have been told, and we've read in several places, that instances of domestic violence have unfortunately risen or were expected to rise during the pandemic, particularly during the lockdown period. It would be helpful to have some indication about whether that happened and whether the MASH experienced more referrals from elsewhere or calls from elsewhere. On page 18 at the bottom, paragraph 35, and I'd like some clarity on this because it's either misleading or it's seriously disturbing. On the 10th of July, we're informed the authority was allocated £858,285 by government in order to support people struggling to afford food and other essentials due to COVID-19. I'm sure that was very welcome funding. But it says at the conclusion of that paragraph on the top of page 19 that the system to administer the funding has been developed and the first applications are currently being processed. Chair, that's 2 months later. I would like some clarification as to whether it's actually taken 2 months to set up a system to help some of the most vulnerable families in our community. I think it's extremely important that we have that clarification, and actually that's all from me on this particular report.
Okay, thank you. I mean, there were lots of different questions there to probably different officers, so I'm going to break it down. Derek, if you can address the children issues. Jonathan, do you want to do the domestic violence? And Adrian, I think you'd be best for the 2 months question at the end. So Derek, do you want to go first?
Thank you, Chair. Certainly in terms of the MASH, it's absolutely the case that there was a reduction in overall inquiries in the early part of the pandemic. That situation has started to change as the public have become more and more in circulation over the summer months. In terms of the latest situation, though, I think the most appropriate response, Councillor Rose, is for me to take that question back to colleagues in Children's Services, and we'll ensure that we give you an up-to-date assessment of MASH volumes as we stand at the moment.
Thanks, Derek. Thank you. That's very helpful.
Thank you. Jonathan, was there anything you could add about the domestic violence element of it?
I will just add that I think it might have been this committee or possibly another one that heard a report earlier in the summer about commissioning of some temporary emergency accommodation for people fleeing domestic abuse, and that was put in place in order to mitigate some problems in the accommodation system generally, which had become which was full to capacity, dealing with other needs that districts and boroughs were attending to, and in anticipation of an increase in the number of people seeking to flee domestic violence when lockdown measures were relaxed, the council agreed to commission some of that accommodation, and that is in place now and is being used. I don't have up-to-date information about the extent of its use or how full it is, and I could bring that information back with what Derek's offered as well, if that would help.
Yeah, thank you, Jonathan. I don't think that that did come to this committee. I think that was a Public Health Committee, that discussion, but thank you for that. I think that clears that one up. And finally, Adrian, would you like to just comment on the 2 month issue?
Certainly, thank you. So I can reassure members that whilst we received notification in July of our allocation, the scheme went live in August. We've had a total of 30 requests come in for access to the Emergency Assistance Fund. 11 of those have already been processed, having been deemed to meet the criteria and have been paid out. The rest continue to be assessed. I'd also want to convey to members that this is a proportionate system. We're recognising that a lot of the organisations that will come forward to access this fund will be smaller, possibly spontaneous, volunteer-led organisations. So whilst we've worked with colleagues in audit and other parts of the organisation to ensure we've got a system that's robust and meets due diligence around the use of public money, it is nonetheless proportionate, so it's not overly burdensome for those applying for it. I think of the 11 projects that have already received funding, that totals just shy of £77,000 so far, and we'll happily provide updates on an ongoing basis to committee as those funds are paid out.
Thank you. I've got Joyce Bosniak and Rachel Madden who have indicated. Nobody else has indicated. So Joyce, would you like to go next?
Yes, just to add to what you said, Chair, the paper on domestic abuse did come to Adult Social Care and Public Health. I remember it well. But my question, and I'm glad Alan's raised the one about the emergency assistance grant, because I was quite alarmed when I read that we'd been sitting on that money for a few months. But I'm grateful for Adrian's explanation. But my question's around the Nottinghamshire Community Fund, because I can see that we've awarded 249 payments for a total of 673,000. I'd just like to know where they are, how widely dispersed across Nottinghamshire they are, because I suppose we, as elected members, we'd like to know that certainly some of the more vulnerable groups within our own communities are aware of this and they are getting access to it. So I'd like the information about where they are and which groups have applied for it. And similarly, on the grant for food and essential supplies, I'd like to have a flavour of where those applications are coming from as well.
Thank you, Joyce. I'm not sure if Adrian can give you very specific figures, but certainly give you more than a flavour. What would you like to add to that?
Certainly. So what perhaps I can offer Councillor Bosniak is that we circulate some details with some breakdown of where the successful bids have been awarded, both in terms of the Food Assistance Fund and also the Community Fund. I think we did provide an update before the summer to members on the Community Fund, but perhaps not since. We did agree at Communities in Place Committee a fortnight ago that we bring that fund to a close later this month, but also that we would write out to all members to let them know who had successfully accessed the fund. So I'll make sure all members receive that in due course.
You happy with that, Joyce? Yeah. Okay. Thank you. Rachel, you're the. Oh, sorry, Rachel, and then Michael. Rachel. Rachel, are you there?
Yeah.
Rachel, I'm going to have to move on if you're not there. I'll come back to you, Rachel, if you're there. You seem to be having trouble getting through.
I'm here.
Okay. Do you want to ask your question or make your comment?
Right. Thank you. Alongside Alan, I do have concerns as well. Point number 19 about the A levels. It caused considerable distress across Ashfield, and we, as councillors, received dozens of angry and upset calls from parents and pupils. It's a bit of a shame because we're quite a deprived area and we're more affected than anything. What was worrying to us was that the government had been warned 2 weeks beforehand by the Education Select Committee. This was a shambles and it could have been avoided. I appreciate that this council doesn't have responsibility for much of this, but I do feel that we should, as a corporate parent, have shown more leadership on this. My next one is on number 27, about the Customer Service Centre. The problem there was that the magic number was the same as the normal customer service one, and lots of residents faced difficulties in getting through, especially on a Monday and a Tuesday. This council, Notts County Council, was bailed out by the borough and district councils. For instance, at Ashfield, between March the 19th and the 31st of July, we dealt with over 40,000 queries, the vast majority of which related to COVID. We attempted to reach every single resident that we had. I myself was allocated 3 wards to ring for welfare calls to make sure that people were aware of what was going on. But because of this number being the same as customer services, we found that lots of residents who required help turned to us, and we dealt with over 30,000 calls and helped with the vast majority of needs. This alone, I think, shows the importance of our borough and district councils. So take note, despite the silence on the local government reorganisation. My last point is on number 34. After a huge fanfare, £326,819 of the Million Community Fund went unspent. This council, Notts County Council that is, needs to look at its community engagement strategy. It's all well and good sending a press release out and a few tweets and Facebook posts and emails to 6,500 people. 6.5? Excuse me, there's quite a few more people in county than that. A lot of the groups didn't know that this funding was available. We in Ashfield rang round to identify community groups, resulting in several applications that brought in over 40,000. But 2 weeks after its launch, 70% of the community groups still had no idea it's even existed. I'm proud that us here in Ashfield actually got on up and did something about it. Also within that, which has been raised before in other forums, there is disparity in how much community groups received. For example, a community group in Selston, providing similar services to one in Rushcliffe, only received £500. Rushcliffe got 5,000. This makes me wonder about who's the person actually doing the decisions behind it. Surely if this ever happens again, applications need to be looked upon on their merits and not have any political interference. Thank you, Chair.
Okay, well, I'm going to take those as comments rather than political comments rather than questions directly to an officer. I'm not sure anybody could add anything to what you've just said. I'm pretty sure that everybody would disagree that applications are not dealt with on merit, but that you're entitled to your opinion. Thank you, Rachel. I've got, I think, Michael, you were next, and then I've got Kay and then Ben. Thank you, Michael.
Thanks, Chair. If I may, just want to pursue the point about the Local Authority Emergency Assistance Grant Fund for Food and Essential Supplies. I hear what Adrian's saying in response to Councillor Rhodes, but if you go onto the government website, they're very clear that they expected principal local authorities, i.e. ourselves, to be spending the funding from July. It's not a ring-fence fund, and they also very clearly state on the guidance that has been issued to councils that they would anticipate the funding to be spent within 12 weeks, and we're clearly now running either very close to that or beyond that. If you take July as being the benchmark, irrespective of what Adrian said about the funding coming through later than the government announced, to be honest, that's the government's problem, not ours, making ministerial announcements and then not following up with the funding. The other thing that I am really concerned about, Chair, and I absolutely accept that, as Anthony said earlier, that this is a very fluid situation and that colleagues at the County Council have had an awful lot to deal with over the recent weeks and months, is that to have only issued £77,000 out of a fund of £850,000 £58,285, which is intended for emergency support to those people who can't feed themselves or their children or their families, is deeply worrying at a time when we've heard from the Director of Public Health that we are seeing spikes again in the virus that is clearly going to have an impact on the most vulnerable. And I think what this report doesn't elucidate on is what thought we've given to how this fund could support people who have individuals with no recourse to public funds. If you read the government guidance, it talks about how this fund should also be there to support people with no recourse to public funds, where they may have community needs, serious healthcare problems, or where there is a risk to a child's well-being, and there are issues around immigration status as well. It seems to me like we've gone for a relatively easy option of giving out the fund to community groups, which I would support, Chairman, of course, but I've heard very little about how we intend to support individuals directly in the areas that are our most deprived. And the government gave this funding weighted on population, topped up by the indices of multiple deprivation, and the government should be applauded for that. They did that to try and get this funding towards those who are the most vulnerable, and we could all think of the areas in our own division, Chair, that would need this support. So I'd like to see a much more meaty, weighted report circulated, Chair, through you, Chair, as a request to us as a committee, and for colleagues to go away and think about some of those additional requirements that have been set out in the government guidance, so that we can have some assurance, Chair, that we can get this funding out the door to people that need it. I know it's difficult. I know officers are under a lot of pressure, Chair. It's not about pointing the finger and pointing the blame, but if we're here as a committee to do a job, it is our job to press and challenge in a constructive fashion, and that's what I'm seeking to do by raising that issue, Chair.
Thank you, Michael. That's a fair point and a constructive comment. Jonathan, is there anything you can add to that? Does that sound like a sensible way forward or not?
I'm sorry, Chair. I missed the cue. I'm sorry.
Oh, don't. I think actually probably Adrian's probably the better person to answer that. Adrian.
I beg your pardon. Sorry.
Don't worry, Jonathan. Yeah, I'd be pleased to. And whether we do it through the next update to this committee or in a specific report, I'm sure we can provide some of that additional data. Let me offer some further reassurance to members as well that I referenced in my earlier comments that we've had 30 requests that are currently being processed. If we were to pay all of those out in full, and forgive me, I haven't got the detail of all 30 projects to hand, that would allocate a further £438,000 of the money that we've received from government. So you can see that we are accelerating the processing and allocation of the grant. And from a glance at the breakdown of the funds, they are going to areas of need to reflect the guidance that we've got from government, but I'd be pleased to bring a fuller report to a future committee through you, Chair.
Yeah, I think that would make sense. Are you happy with that, Mike?
Yeah, I think so. And if the information can be shared in a more timely fashion with us, Chair, I don't think we need to wait to the next committee circulating the email and sharing things in a transparent fashion with us as a committee. I think, there's nothing to hide, is there? And I think, as Adrian says, if we are going to get half of the fund out of the door when we've got these 30 applications processed, that's got to be a positive, and it'd be interesting to see that information.
Yep, fair enough. Kay, I've got you. Joyce, is yours a legacy hand, or are you asking to what? Are you wanting to ask another question? Your hand's up. You're on mute. I'm assuming you don't. Kay, would you like to?
Yes, thank you, Chairman. Mine's on the community fund that the County Council put up very, very early days. If you look at it, we came 31st of March. Well, lockdown started on the 23rd of March. So this fund was in place very, very quickly. Had £1 million in there, and it was absolutely community-led. So people dialed into this fund if they wanted help in their areas. It was very interesting, actually. We had a lot of people who replied to us. The guidelines were quite clear. The guidelines would help people through an emergency. It was also to help volunteers deliver things to people's homes. So it was a very comprehensive. We had at the initial stages very few requests from both Ashfield and Gedling. And we went out a particular trawl for these areas and said, people in Ashfield and Gedling, would you please, if any of you do want any of this funding, apply, because we're very quick off the mark. But in the end, it's all levelled itself up. Some of the requests were inappropriate because it was volunteers who were delivering these things. And I remember one or two of the requests were for volunteers to be paid to deliver these things, which was not in the spirit of the fund at all. The Citizens Advice Bureau across the county took part in a lot of this and also administered this through their own Citizens Advice Bureau and giving advice to people on where they could go and get further help. So no one was left bereft with this. The fund was £1 million. Any underspends, we did ask again for it to be people to come back in. This was well advertised, and you see that the fund is now closing. But of course you can have a list of this. You've had several lists because we've been criticised in the past for not being even-handed about this. So everyone's entitled to have a look at where the money was spent and where the applications have been successful. And may I say, we've had some very nice replies by people saying how grateful they were that the County Council set this fund up so quickly, added to the local people through the parish councils and the town councils who are also carrying out these type of volunteer organisations. So I think it has been very successful and is a real good example of this council working quickly with people to get the emergency funding out of the door for those things when the crisis was its highest and the lockdown was the most severe. And I think in the meantime, things like the supermarkets have come forward and have more delivery spots now for food. So there's a reduced request for volunteers to deliver food to people's homes. But I think at the time it was absolutely vital to keep the county going. And I'm very proud of what this council did. Thank you.
Thank you, Kate. Mike, I've got your hand up again. No?
Yeah, it's just in relation to that point, Chair, just from my perspective as a county councillor in Gedling, I think the county council deserves credit for the COVID community fund and certainly I've said that on previous occasions, and I think the leader of the council is right to refer to that just for clarity, because I think Kay's right about, and certainly I had conversations with officers around Gedling applicants not being as many early on. I think there are two partly reasons for that, Chair, which is that there's still a very robust CVS sector in Gedling, and also when we met with our colleagues throughout the crisis, they realised that there was already sufficient funding coming from the County Council and the Borough Council jointly. The Borough Council stepped up to the plate and it was a joint effort. So I think the county deserves credit, and I think clearly it's a mixed picture across the county, and I think the fund worked for that purposes. If people needed the help and assistance, they drew down on it, and if they didn't, they didn't. And I think that was the beauty of the fund being fleet of foot. So I certainly would give credit to the county, and I think it was very positive that the county moved swiftly to set up that fund.
Yeah. Thank you for that, Michael. I've got nobody else indicating that they want to speak. I think we've given this a good airing. So I'm going to actually move to... Oh, sorry, Ben, I beg your pardon, because you're down as a guest. I can't see your hand at all, Ben. So sorry if you want to...
I'm on a non-council machine. It was a very brief one, and it might just be a case of pointing me to another report somewhere, but appreciate this is a kind of place report, but there is a section obviously around vulnerable children and particularly in school settings. And I wonder, I'm yet to see any information about how kind of school catch-up kind of funding or support has been used. We heard a lot before the summer about summer programmes, clubs, catch-up funding, and how that will be utilised to support kids who most needed the kind of academic catch-up as a result of not being in school. There's nothing about it in this report. I wonder if there's another one that I should be reading, or if we could get some more information about that. You're on mute, John.
Yeah, I've got you. We're going to get you a follow-up report on that, if that's okay, Ben. Was that going to come through you, Derek? Derek's going to forward that through to you. Is that okay? Thank you very much, Ben. So I'm going to move on to the vote now. The recommendation, as you can see, there are two recommendations. I'm going to read them verbatim for people who may be watching live who are not part of the committee. That members consider whether they require any further actions in relation to the issues contained within the report. And that number two, that members agree to receive further updates at subsequent meetings. Keith, same process again, please, if you want to read out the names.
Yes, certainly. So starting with Councillor Regiday.
4.
Councillor Joyce Bosniak.
4.
Councillor Ben Bradley.
4.
Councillor Mrs. Kay Cutts.
4.
Councillor Stephen Garner.
4.
Councillor John Knight.
4.
Councillor Rachel Madden.
4.
Councillor Michael Payne.
4.
And Councillor Alan Rhodes.
4.
Thank you, Chair. So that's again unanimous, all votes in favour.
Good, thank you, colleagues. So we're now going to move on to the next agenda item, which is beginning on page 27 of your papers. I'm going to pass this over. I think is it Rob who's dealing with this one? Yeah, Rob Fisher, are you there, Rob?
Yes, thank you, Chairman. If I may, just a few words of introduction to this report. It provides a further update on recovery and resilience, work by both the County Council, but also in partnership with the local Resilience Forum. As the committee has already heard, lessons have been gained from the earlier stages of the response, and our resilience is improved in readiness for a possible further rise in infections and deaths in the coming months. The report details that our preparations have been informed in part by the reasonable worst case scenario planning assumptions given to us by the government, but also by the debriefing that's been going on and was referred to earlier in the meeting. Interim feedback from the local Resilience Forum debrief has indicated that the multi-agency response has been effective, and there was particular praise for the tactical coordinating group led by our Director of Public Health, Jonathan Gribbin. The report notes that a successful large-scale exercise was completed on the local outbreak control plans, and that took place on the 29th of July, and the outcomes of that confirmed the strength of the partnership working within Nottinghamshire. This report includes reference to the LRS Recovery Coordinating Group, which is now fully established, and it is this report also that provides the roadmaps, the management structured diagrams of that multi-agency COVID-19 response and recovery. And they're showed in the appendices to this report. Very happy to take any questions members may have.
Thank you for that, Rob. I'm just going to formally move the recommendations, which are on page 31, I think, of the agenda. Can I have a seconder for that, please?
Second that and reserve the right to speak.
Thank you, Reg. So I'm now going to open it up. Any questions or comments? Councillor Rhodes, I've got you first.
It's not a flippant question. I'm sorry if it comes across in this way, but I'm quite surprised at the complexity of the structures for response and recovery. I think only the public sector and possibly the civil service could come up with these sort of complex structures. Is this our own creation, or are we following national guidelines?
Well, let me just jump in there, because when it first came, believe it or not, this is the sharpened up version. When I first saw it, I sent it back because it was practically unexplainable. I couldn't understand it, and nobody I showed it to could understand it. So I'm disappointed that you still can't understand it, Alan. I accept that it's.
I'm just a simple chap from Worksop, John. You know, I mean,
Alan, nobody knows that better than me. However, I mean, I do take your point, and I'm not sure, Jonathan, how we could have made it much simpler without it actually not serving a purpose. I did send it back to you. I've written it off, so I'm in trouble if I think you could have made it easier. Is there anything else we could do? Because I can't think of anything else.
But the question, just to remind you, was whether it was our creation or whether we were following national guidelines.
It is ours. Jonathan, sorry, Robert, is there anything you want to add?
Yes, please. Thank you. Our generic emergency plans that gave rise to this structure, the starting position is a lot more simple than this. Some of the main components, the strategic coordinating group, the tactical coordinating group, and the recovery coordinating group are part of that structure. So in the plans, its starting position is very simple and straightforward. What happened in this response, I think it is directly in relation to the demands of the response, is that the structure has evolved, that where there has been a need for subgroups, they have been established. And indeed, some were established and their function has changed. The local authorities group, the plans always envisaged there would be a cell of that nature. Its initial work was directed fully to the strategic and tactical side of the equation, now more so to recovery. So it has been a dynamic process, but geared directly to the demands of the emergency response.
Thank you for that. I take your point, Alan, and I think you're right. The only thing I would say, and I'm just preempting a report which is coming next. I don't know if you've seen this that we're going to be talking about. I think this has got a far more human face, and this I think is hopefully what people will be looking at rather than this flow chart, which I agree is almost unfathomable, to be quite honest. Anybody? I've got then Michael and then Rachel, please.
Thanks, Chair. And I just wanted to spend a moment saying thank you to Rob, to his team, to Jonathan and everybody who's involved in the LRF. Alan's quite right. It's an incredibly complex beast, but I think we've been very, very well served by the meticulous nature and way in which the LRF has orchestrated and responded to things in an operational level. My only piece of feedback, Rob and Jonathan, would be, and this is not intended as a criticism of you, but I've made this point at Gedling as well, and I've made this point nationally. I do worry that the LRF structure, both here in Nottinghamshire and across the country, is decoupled from political leadership and strategic leadership in response to an emergency like the one we've just faced, a public health pandemic. And I recognise and realise that there clearly will have been ongoing conversations throughout between the leader of the county council and the chief executive. And rest assured that was happening in Gedling between myself and Councillor Clark and our chief executive. But at a very early stage, it felt like the LRF was running off, quite rightly, with its statutory responsibilities in the way it needed to respond operationally, but forgetting about the fact that we are also democratic organisations and that ultimately politicians have to make decisions that clearly do have political implications. And I'm not making a party political point here. I'm simply making a point that we're elected to carry out a role on behalf of our community, and that whilst operational response is important in a pandemic, community reassurance and community response is also important. I'm not for one moment suggesting, Rob, that the county hasn't responded, in a fashion in terms of community support, because it clearly has, and we've heard that earlier in the report. I just worry about, and you probably can't answer this, Rob, but you maybe can share some of your thoughts, having worked in this world for many years. I worry that the government doesn't quite understand that in the same way at a national level you have to have politicians being cited on decisions, and you can't have the operational running away from the strategic and the political. I'm not quite sure we're still in the right place around the LRF structures. So I just seek to make that as a sort of constructive piece of feedback, not as a criticism in any way, but maybe just to see what your own views, Rob and Jonathan, might be. It feels a bit like, to me, we haven't necessarily always been listening to our local leaders. I'd have liked the government to have been listening a little bit more to Kay, throughout this, rather than national politicians thinking that they could call the shots. I'd have much rather they'd been listened to. And likewise, actually, people like Jonathan, if they'd have been listened to a little bit more, a little bit earlier on, I'm pretty sure we wouldn't have got into some of the difficulty that we got into earlier on. So I just offer that as a constructive piece of feedback, Chair, not as a criticism in any way.
I take the point. I think the dynamic between public bodies and bureaucracies and local government and how we respond to it. I think generally we've done very well in this country. You've only got to look at the United States to see how that dislocation has completely worked against the citizens of that country. I think we've been actually very sophisticated in this country, but I do take your point. I suppose the only excuse we've got is nobody's been through this kind of thing before, and we are learning as we go along. If you don't mind, Michael, I'm going to let Anthony come in first on that, and then ask the other two officers who you specified if they've got anything constructive to add. And Anthony?
So this is a point, and thank you, Chair, this is a point, Councillor Payne, that I have been able to make because of the various roles that I've played throughout this. And I have described it in a very simple way. We must ensure that there's no democratic deficit just because we're in a crisis. And that point has been picked up nationally, as I understand it, and Rob may be able to add to this. NHCLG, the government that sponsors the LRF and the RED arrangements, which are the emergency planning arrangements across the country, are constantly reviewing the LRF arrangements to make sure that they're, first of all, effective, and secondly, don't create a democratic deficit. I particularly fed in issues around how we might control local outbreaks as opposed to that all being done nationally. And through the regional lead chief executives, we were able to secure local leadership of outbreak controls. So the leader of this council now sits at the head of a local outbreak control engagement board, and there are 2 leaders from district and borough councils that sit on that. I believe that that was as a direct result of us feeding back that we wanted more control locally and that our politicians must lead, particularly if we're going to give sometimes difficult and unpalatable messages to local communities. Paid officers, bureaucrats, will struggle to do that. We just don't have the ear of our local population in the same way that local elected members do. So I do think those messages have got home. It still isn't a perfect system. It's a system that I think will be refined as a result of the unprecedented learning from this pandemic. More closer to home, the leader of the council was insistent that we stood up this committee, for example, so that local elected members were more in the loop, had more say, and received more up-to-date detail. Because when you're working hand to mouth and day to day, as we were in the first few weeks of the pandemic, it is sometimes easy not to communicate effectively, especially with elected members. So we've tried very hard. I think we've learned a lot, and I'd like to think that through this committee and through the role that we play nationally, that we can make further improvements.
Thank you. I mean, Jonathan and Rob, if you feel you've got anything constructive to add, please let me know. If you don't, then Mike, I hope that is that. Are you happy with that?
Yeah, really helpful, and I think Anthony's nailed it. You know, I seek to make the point as a learning point. It's not about a criticism of how we responded. It's about learning going forward, and it's more about how national government learns about how the framework and the structure works at a local level. And I think Anthony's right. We have seen some tweaks throughout that have been a positive improvement, and credit to Anthony and others for using those channels to make that point. I think it's an important point that shouldn't be lost sight of.
No, I agree entirely, and as I say, I can only compare what's happened in this country to what's happened elsewhere, not just in the United States, but in other parts of Europe, where members of the public are actually just told things almost third and fourth hand. I think we've had very vigorous debates in this country, and particularly in this county, and as Anthony has said, setting up this committee was certainly, I think, a way forward. Is there anything that you want to add, Jonathan or Rob? No,
not in regard to the democratic deficits points. I've observations about the complexity of the diagram, but I think you may have moved on from that.
I mean, well, unless you're going to tell me that there's something we could have done better, I'm fine. But I think Alan's been given an answer to that.
No, I would simply say the complexity and breadth of dealing with what's been the single largest emergency facing the country since the Second World War, I think demands a range of functions, which I could draw a more simple picture for you, but it would simply be covering over the complexity which needs to properly sit underneath it to deal with the range of functions that are required to respond.
Yeah, accepted. I think we've accepted that. Thank you very much. Okay, Rachel, you're next. Rachel, can you put your camera on?
It's on.
Nobody can see you. You're down as a guest.
I can see myself in bottom right-hand corner.
Okay.
I mean, I'll switch it off if you like.
No, you go ahead. You're down as a guest, that's all. Go.
Right. Thank you. I take account of the points raised by Jonathan in his response to item 4, and also what the officers have said so far in response to the other councillors' things. And I am also concerned about unknown factors such as the possible cost of COVID marshals to local authorities. And I'm also concerned that I see this morning that as few as 17 local authorities haven't seen an increase in reported infections. And I understand the complexity of everything, etc., etc. So I'd like to thank those people, Anthony, Jonathan, Rob, etc., for outlining things in a little bit more simplicity. But have we the ability to outline what lessons from the earlier stages have been learnt, and how could these impact on the possibility of a second wave of coronavirus? Thank you.
Okay, before I pass that over, just to clarify something, because I think that's misinformation. Who's told you that local authorities are being billed for the marshals?
It's a big thing all over Twitter and the press.
Oh, Twitter. Oh, I beg your pardon.
That
Right.
the cost may come down.
Okay.
There was an article this morning on the LGIU information page that it could cost 85 million, you see, things like this. And you get so many different things coming down from so many different streams.
Okay, I'm not aware of that. I wouldn't believe everything that you read on Twitter, to be honest, Rachel. I'm not saying you're wrong, but I think you're way ahead of the loop there. I'm not sure where that. I don't think the costing's actually been dealt with by central government yet. Anthony, did you want to add something there?
Yeah, only to reinforce that point, Chair. The arrangements, the detailed arrangements for these marshals have not yet been agreed. I think in my role as one of the regional leads, I probably will be consulted on the construction and the financial implications and whether local authorities are going to receive credit. So as soon as I've got any information about it, I will of course make sure that the leader of the council is up to date. But I would just reiterate what you've said. I understand, Rachel, there's a lot of rumour about this and conjecture at the moment. Hopefully we'll get some concrete information in the coming days, which will settle it down.
Thank you, Auntie. Thank you, Rachel. Michael.
Yeah, just to say,
sorry, Rachel. Sorry, beg your pardon, Rachel.
I did say, have we found any lessons from what we've dealt with so far? Can we outline them at all? You may not want to do it now, but email us round. You know, I just wondered what lessons we learned early on. So.
I'm not sure that I'm hoping Rob's already dealt with that. But Rob, is there anything else you can add to that, please?
Certainly, Chairman. The outcomes of the debriefing have been discussed both at the resilience working group of the LRF and in our internal County Council Risk Safety and Emergency Management Board. They are interim and are being fed in some detail. So it's a work in progress all across the summer months to make sure that we've got everybody's contributions. Those surveys have been proceeding. I've included in the reports the anticipation that at the committee's next meeting there will be a more thorough account of what the precise outcomes were and detail those actions that have been by then carried forward.
Thank you. There you go, Rachel. Thank you very much for that. Michael.
I was just going to say, Chair, that Anthony's right. There clearly is a lot of conjecture around the issue of financial burden, potential financial burden for the marshals. But I was on the LGA Leadership Board call last week, and the Chief Executive, Mark Lloyd, who I think is a reputable source, fed back that the MHCLG civil servants and ministers had very clearly said to him that their own view was they'd already given significant chunks of funding to local government to meet burdens, and they weren't anticipating sharing any new funding. And they have made that statement publicly. So I think there's some veracity in the concerns that Councillor Madden expresses. And I think Anthony's right. In the coming days, we need to do everything we can through the political channels and officer channels we've got to push back to make sure that that burden isn't laid with local government, because if it is, it clearly is going to be a big cost burden. And I think we've heard from the leader of the County Council before, there's already a financial pressure on the County Council, even in spite of, the funding that we've thus far received. So we've got a few short days, I think, to continue to make that case strongly. And I think the point Councillor Madden makes is a good one, that we do need to be pushing that case really hard, because it sounds like at the moment, civil servants and ministers view where they are at the moment, although they've not come to a final view, is that they've already given us money and that they're not going to be giving us any additional money to meet those burdens. And that would be troubling, Chair, because it's likely to be quite a significant cost.
Yes, point taken. But my argument would be that the money you have given us didn't at the time include the cost for those extra marshals. So if there is an extra service which has been laid on by central government, then my argument would be that should probably be funded by local government.
Correct.
Members agree?
Correct.
Okay. Thank you. Well, Anthony, can you bear that in mind when you're obviously doing your lobbying? I think those points made by Rachel and Michael are valid. Mike, you still got your hand up. Are you? No, thank you. Anybody else then, please? No? Good. Okay, thank you. So we're going to move to the vote, and again, I'm going to read it out verbatim. So members consider there require any further actions in relation to the issues, and members agree to receive further updates. Keith?
Yep, so starting with Councillor Regiday, could I have your vote, please?
For.
Councillor Joyce Bosniak. Councillor Ben Bradley.
For.
Councillor Mrs Kay Cutts.
For.
Councillor Stephen Garner.
For.
Councillor John Knight.
For.
Councillor Rachel Madden.
For.
Councillor Michael Payne.
For.
And Councillor Alan Rhodes.
For.
Thank you. So that's again carried unanimously.
Okay, good. Thank you very much for that. We're on to the final main agenda item, which begins on page 35 in your report. I'm going to introduce this item, and I'm going to hand it over to Adrian to begin it. So, Adrian, please.
Thank you, Chairman. Could I start briefly, members, by introducing Matt Neal, who is our new Service Director for Growth and Investment. And Matt joined the County Council the week after your last committee meeting in late July. And I seem to remember at the time, Anthony trailing Matt's arrival, that he would come in and help us bring forward this recovery plan. So I'm delighted that Matt's joined us, and he and Nicola McCoy-Brown, who's also on the call, have worked since that committee meeting in late July, where members approved the framework for this plan to put together the document that is appended to the report that we are seeking your approval for. So the plan has been brought forward in parallel with plans at both the LEP level and the Midlands Engine level, looking at how we can support the recovery of our economy post-COVID-19. And it's been based on evidence that's been generated both by the LEP but also the Midlands Engine Observatory, which has been a really rich source of data for us. But it's fair to say that that data is emergent, it's dynamic, and it changes rapidly. And accessing up-to-date information has been really challenging. So members can see in the attached report how we've built on the 5 themes that were agreed in that report back in July around people, place, infrastructure, business, and the visitor economy. And it sets out the actions that we intend to take subject to your approval over the next few months and then the next few years. We've already had some successes, which I'm delighted to report back to committee, because members will, I'm sure, recall that at the time we were developing 4 projects for submission to the LEP in order to access the government's Get Britain Building Fund. I'm delighted to report to members that 2 of those have been successful. And so we'll be bringing forward £3.6 million of new investment into Mansfield and Worksop, principally around the infrastructure and place themes that are set out in the report. And there's detail in the report, as I say, in relation to both those schemes. We've also secured recent committee approvals for a series of other investments into the economy of Nottinghamshire, not least around the development at Totwig Hay Farm, where we've levered in significant external funding, but also using some of the County Council's own capital resources to bring forward developments both there and across the county. And importantly, we stress that by using our partners ARC and VIA, we're able to channel quite significant investment into our local SMEs. In fact, 90% of spend that goes through ARC goes into small and medium-sized enterprises in the county. I'm delighted to report as well that the employment portal that we discussed with members at the last committee has gone live today on our website, and that provides a bit of a kind of one-stop shop, if you like, of access to information and advice to whether that's young people, people who are on furlough or have been made redundant through COVID, but also to businesses and SMEs who might struggle to find the information or the support that they require. And that's both on our website and will be available through the My Not app in due course. And then lastly, I wanted to briefly touch on the other projects that we referred to back in July that weren't awarded funding. We'll be coming forward to the relevant committee later on this month to secure approval for one of those where we've been able to attract and secure funding from another government source around the gigabit voucher scheme, which again is set out in the action plan, and there'll be a further report into committee later this month around other projects coming forward in that pipeline. So the recommendations are on page 37 of your report pack, at which point I'll hand back to you, Chair.
Thank you very much. And Matt, I know I've spoken to you informally, but formally welcome to Nottinghamshire County Council. Welcome to Nottinghamshire. We look forward to working with you. I'm going to formally move the recommendations which are included on page 37. Can I have a seconder, please?
I'll second that and reserve the right to speak.
Thank you, Reg. And now I'm going to open it up to members for questions or comments, please. Looks like you've got away pretty well. This, Matt. Oh, and no, here they come. Alan first, and then Kay.
Yes, thanks. I mean, well, these documents are what they are, and I've seen dozens of these over the years, and they're all a bit of a muchness. But you know, usual pictures of happy families rambling through woodland and all of that stuff. I'm not sure that it tells us a great deal that we don't already know, and any of us that have been on policy committee and various other committees over recent months and years will know all of this stuff. I'd be interested to know, first of all, who the target audience is for this. So who's going to receive it? What's going to happen to them? And not to be too mischievous, but there is, of course, one glaring omission in the section about this is what the council will do next, and that is local government reorganisation. This is a committee that has local government reorganisation as part of its remit. Hasn't been mentioned at all, actually. Ironically, the day before the council seeks permission to proceed at the policy committee tomorrow, and it isn't mentioned in the section about what the council will do next, despite are being informed by the leader of the council that it is part of the recovery plan. So the joined up thinking seems to be missing here, and some explanation as to why that is would be quite helpful, I think.
Okay. Well, I disagree about the quality of the product. I mean, you were just complaining a minute ago about the last one being very static and bureaucratic, and now you're complaining about this one being inane. I mean, what we tried to do was make this readable for members of the general public, not politicians, not bureaucrats. To answer your question about where it's going to go, we did look about sending it to every member, every household in the county, but that was ridiculously prohibitive. So we are going to take it to libraries, to district and boroughs, to parishes, importantly. I think the universities are going to get it, but if members have got suggestions of where else they'd like it to be sent as a hub, we will certainly do that. Can somebody come in and answer any of the other questions or concerns that Councillor Rhodes has mentioned there? Adrian?
I mean, I think the only thing I'd reflect in terms of your question about the omission on local government reorganisation is that would have been preemptive because we haven't got any formal decisions to proceed at this point. So we'll have to reflect on that in due course.
Sorry to interject. It's always been said that it's part of the recovery plan.
That's probably not an issue for me to respond to, Councillor Rhodes.
Okay, thank you. Kay and then Michael, please.
Yes, if you want to know anything about local government organisation, Alan, can I recommend you go and look at the County Council's website, their microsite there, which is devoted to it. All the information will be put on there for members of the public to look at. because I think members of the public are being woefully misled by some of the statements that are being made. And I think it's really important we start to set out the truth of the matter, or where we are with these things. There's no doubt about it that coronavirus has made a great effect upon our country and on the economy of Nottinghamshire as well. And therefore, we have to have bold and ambitious plans to try and lead us out of this. We have taken our part very closely in things like the Midlands Engine, Midlands Connect, which is transport, and with the HS2 line as well. This council is really putting its weight there, which can I say, it wasn't there before I took over as leader of this council, particularly the HS2. HS2 East Coast Eastern leg actually is a very important piece of infrastructure which needs putting there. It goes from Birmingham via Nottingham. It serves the counties of Derbyshire, Leicestershire and Nottinghamshire and the cities of those three counties. Then onwards towards Chesterfield, which I thought would be a bit nearer your heart, and then over to towards Leeds, the largest county in the country, which is not on any major rail network, a population of over 700,000. And then it joins the East Coast line. So you'll be particularly well served where you live in Worksop or Retford, because the East Coast line, of course, goes all the way up the East Coast, and this is joined there by the new HS2 line. We have taken a very strategic part in that. You can shake your head and disagree with it.
Why are you telling us this? We've never heard it before.
Members, let me, I'm coming in here. Alan, please. Kate.
No.
We've had a really good committee meeting. I've made it specifically clear I do not want to be talking about local government reform in this committee, precisely because we've got a meeting at P&R tomorrow. Now, these points you make, Alan, perfectly legitimate. Kate, perfectly legitimate. This is not the forum for it. Can we stick to the local recovery action plan, please, and leave the more generic politics till tomorrow when you can both go through this again? Thank you. Kate.
This isn't about politics. This is about...
Kate. I've been dying to say this. Kate, I'm quietening you. Shh. That's it. Finished. Alan, finished. Can we just... Right. These points tomorrow, I'm sure you're both going to be kicking off on this again. Right? Michael, it's not about local government reform, is it?
Well, Chair, I'm at a loss really, because I thought it was in the terms of reference. The point I was just going to seek to make is it is a bit galling to hear a corporate director say that it would have been preemptive to talk about it in this report when there is a hang on a minute, Chair, when there is a microsite that we've just been referred to by the chairman, by the leader, that very clearly states the county council's preferred position. Yesterday there was a video issued by the lead spokesperson for finance advocating the position on reform. Your own forward, Chair, to stick to the issue that you're asking us to stick to, your own forward in the report talks about in the short to medium term, we recognise there is a need for a partnership approach that will focus on the future. I couldn't concur more, Chair. I think you're right, but you don't achieve a partnership approach by putting a sledgehammer through the structure of local government. So I think to hear somebody say it's preemptive, and then in the next breath to hear the leader of the council say, check out the publicly available microsite that very clearly says that the county council's preferred stance is unitary local government, and for the county council's resources to be deployed with a video showing Councillor Jackson yesterday advocating that, I think is disingenuous, Chairman. And actually, it wasn't me or Councillor Rhodes or Councillor Bosniak who established the terms of reference for this committee. It was the administration, with the greatest respect, and I don't levy criticism at you for that. And the terms of reference of this committee clearly do say that local government reorganisation is part of our remit, Chair. So if we're going to debate as a democratic organisation, then let's debate as a democratic organisation. And if we didn't want to debate that, we ought not to have put it in the terms of reference for this committee.
No, I accept that. However, it isn't a specific agenda item. I take what you're saying, and we could go on with this for a long time, but I'm aware that we're probably going to be debating this at a much greater level tomorrow. However, people on this committee aren't all on P&R, so I take your point. Kay, did you...
I do want to come back, Chairman, because I was actually...
I've got you, Joyce. Yeah.
Okay. Right, okay.
I was actually talking to pages 7 and 8 of the paper which we have there, the recovery plan. Pages 7 and 8 clearly set out where our ambition lies: the transport systems, communication network, development corporation, investment in infrastructure, and the free ports. All of these are leading towards the recovery of the county. It is because we are represented on all of these organisations, we are able to make Nottinghamshire one of the big voices there and selling our wares, because I've said so often the West Midlands gets more infrastructure spending than just about anywhere across the East Midlands, and yet we need to be shouting very loudly about this. Last week I was at a meeting with the Midlands Connect, where we agreed between 3 of the counties together that the A1 would be redeveloped across the whole of Nottinghamshire and Leicestershire, because it's poorly served. It works well to Peterborough, works well from Peterborough, it works through Nottinghamshire, and then again out at the other end, it's again the motorway standard. It's not the motorway standard through Nottinghamshire which we desire. I think there's nothing wrong with pointing that out there, because this is part of our local recovery plan. We are part of the HS2 system because we do need the infrastructure there. We need the infrastructure there because we need the jobs there. We make planes, trains and automobiles across the East Midlands, and none of that's reflected very well. And I think it is important, where we've got the skills happening through our universities and colleges and schools, that those places do have jobs for apprentices, for people going on to higher education, whether that's college, whether it's going to be an HND or a degree. All of those skills need to be for local jobs, because we haven't had the local jobs in the past. And consequently, Nottinghamshire has been one of the poorer parts of the country when it comes to this, though you wouldn't know, because I think we do extremely well with what we're doing. The Locally Led Development Corporation, will you see some very interesting structures there. Again, the East Midlands Airport is looking to be a free port, and that's part of the Development Corporation. So is the Toton Station, where we're going to have a garden village and infrastructure there to improve the environment. And then we have beyond that, the rest of the Development Corporation around Uniper, the site at the East Midlands, by the Radcliffe-on-Soar Power Station, which is going to be decommissioned as it burns coal, and have a carbon system there, which is going to clean the atmosphere up and also deals with waste, and that's a current application. These things haven't happened because we stood on the sidelines and wrung our hands. They have happened because we have taken an active part there. We make sure our county's voice is heard on the stage of the East Midlands and across the country as well. And therefore I think it's a great shame when people just want to talk about local government reorganisation, dissing everything, without looking at where it might lead, because together we are better and stronger. And I think we would be better than the sum of our parts if we were all together. And that's why I'm so keen to lead this council in the right direction. And that's the remit I think I've been given by the public. So, Chairman, I was speaking to your document, I think it's a very good document. I think it's got a particularly nice photograph at the front, which appears to be you. Very nice photograph, John. But I think I could recommend this to anyone, and our library should all have a copy in it. Thank you.
Okay, thank you. I did let Kay come back there, Joyce, just because Michael had specifically made a reference to something that Kay had said. But I'd be grateful, colleagues, in future if you address your questions through me, and then I can put them to the relevant parties. Joyce, sorry about that.
Yeah, thanks for the apology. But as you're aware, Chair, I'm no longer on the policy committee because our representation was reduced, and that irks me considerably. However, I was really happy to come on this committee because I felt that it was addressing not just COVID, but the things that are important to Nottinghamshire. So I would like to say, I don't want to hear from you, John, that it's going to be discussed tomorrow at policy. You can have your arguments there. I thought we were going to get down to some of the nitty-gritty here and unpick some of the ideas. And that's what I'd like to see within this committee in the future. So that's my only point. I regret the fact that we're not able to speak about it today.
Thank you. And I did preempt that by saying I agree. I realised as soon as I'd said it that not everybody is on the P&R committee. So you're quite right, and I take that criticism on board. Thank you. Michael, is yours no? Okay, so I've got nobody else indicating to speak. Is there any, just to talk about the document, whether we're for or against it, think it's good or bad? It will be absolutely useless unless it gets seen by people. Has anybody else got any other suggestions about where it might go, other than districts, boroughs, parishes, libraries, the most obvious places, the universities? In other words, hubs within the county where people can pick it up and read it. Mike, Michael, are you indicating?
Yeah, please, Chair. Just in terms of the document itself, I know the back page, just in terms of the specifics of the document, does refer, Chair, it's not about where it should be distributed, but refers to the performance monitoring and measurement, and it talks about the individual data sets, which I think are really helpful, and it does make reference, Chair, to the intention to have clear performance indicators. I'd just be really interested to, when they're fleshed out, they may not be yet, what they might be, because I think that is somewhere where the committee can feed in, Chair, given the conversations we've had in previous committees around the holiday hunger issues, food poverty, educational attainment, I know some of which are referenced, economic growth, some of the issues that Councillor Cutts has referred to in terms of transport, investment and infrastructure. I would welcome a conversation around that, because I think that is an issue where we can absolutely get into some nitty gritty and feedback our views as elected members, Chair.
Yeah, good point, Michael. Thank you. Anybody else on the document before I move on to the vote?
Can I just ask, Chair, if there's an online version of this, a link that could be circulated to all councillors? If we're trying to get as many people to see it as possible, there's no reason we can't all share it. That's right.
Yeah.
Chair, I'm not sure whether you're able to see, but I have put my hand up.
I'm sorry, Alan, I missed you. I beg your pardon. I've seen you. I've just answered that question first for Ben. That's correct, is it not, officers?
Certainly, we'll make the document available online with a link we can send out.
Thank you. So, I've got Alan and then Reg, please.
Okay, let me just go back to the original point I made. I mean, the document is what it is, and I don't have any problem with endorsing that document. Very happy to endorse it. I'm sure that you'll circulate it in all the right places, and that it will attract some attention. I think it's a bit of a niche market, incidentally, but it will attract some attention. I have no issue with endorsing the document. My issue is that, in my opinion, it is incomplete, because clearly there are some matters that are far too contentious to put in this document. I think that's the truth of it. But let's not go back over that. I accept and respect your ruling, Chair, about the discussion on local government reorganisation, although I think it's unfortunate because it is part of the remit of this committee, as we're all aware. But if it's on the too difficult to talk about pile, then so be it. But the Labour Group will vote in favour of this report and will endorse the document.
Thank you very much. I mean, it's not in the too difficult to talk about pile. I accept Joyce's criticism that not everybody who's on the P&R committee is on this committee, and local government reform is part of this remit. I accept that. What I'm trying to do is make sure we focus on the medical and recovery issues first, not solely to the detriment of local government reform. But I think, if we bear in mind that it is going to be discussed at greater details elsewhere, then I think, we'll be happy with that.
Happy with that comment, Chair.
Thank you for that, Alan. Okay, Reg.
Yeah, I think we always look for the negatives, don't we, when we're looking at something? Why don't we look at the positives and try and deliver some things from the positive side? We've got a document here. It's a foundation. It's a start. It's something we didn't have a few months ago because we didn't have COVID. Now we've got a start of something, building on what we already had, and we can build on this. And I think what we need to do now as a committee and as individual members of the committee, we need to get this circulated out amongst our population, who will be wondering what we're talking about. And if we get this document out, it'll give them some lead on what we're talking about and how we intend to rebuild the economy of Nottinghamshire and elsewhere as we go into post-COVID going forward. So let's take positive and think positively about things. The LGR is obviously someone people want to have a row about. I don't want to have a row about that. I want us to rebuild Nottinghamshire, rebuild the economy of Nottinghamshire for the people of Nottinghamshire and the surrounding areas, and get forward in an economic process. So I think this document now, and I would say we need all our MPs bought into it and see it and take it as a document that we're going to build on. All the associations that we work, Midland Engine, Midland Connect and HSR2 and all the rest of them, also be part of the rebuild of Nottinghamshire, take a process this and rebuild this document. Maybe in 9 or 12 months' time, we can update and upgrade this document to where we are and what we're doing. and I agree with Michael, we need the KPIs of what we're doing and the progress we're making and how we're going forward. Let's stop being negative and just go forward and take something positive of what we can do, because that's our duty, that's our job, is to deliver post-economy from COVID into Nottinghamshire and elsewhere.
Thank you, Rach, and I can only echo that. I take some of the points you say, Alan. I mean, I suppose if when I read it, there were certain things that I wasn't too happy about. There were other things I thought were too simplistic. There were other things that were missing. You're quite right, but I think the most important thing is that we're actually producing a document which is going out to members of the general public. So in other words, we're doing something constructive and transparent. Not every other county council, as far as I'm aware, have produced a document like this that's going out to members of the public. Now, that would be, I think, a mistake. And had we have put nothing out, I think you'd have been the first to criticise us for not doing it, and quite rightly. So I take your point on board that it does need refining. Trust me when I tell you, as far as I'm concerned, we didn't miss out local government reform through any Machiavellian reasons. We just didn't think that members of the general public were going to pick it up and be that interested in it. It was trying to be constructive and also trying to show how we're going to bounce back from this. That was the remit that the officers were given, and I think within that remit they've done a pretty good job. But you're quite right, and Michael will take that on board about when we update it. So is there anybody else who's got any final questions before we move this to the vote? Mike?
Just a positive suggestion in the spirit of the, I think, reasonable challenge by Councillor Adair. Well, it might be good to think of, Chair, whether we could get some talking heads, to do some short snap videos on the key points in the document, like on transport infrastructure. Let's hear from somebody who's working in that area in the county on the issues around supporting people in vulnerable areas. Let's hear from somebody who's experiencing those services, to bring the document to life, as Reg says, so that people can actually understand, what we're talking about. And I think people seeing other people talking about something is always an easier way to get your head around it than actually reading in a document. I mean, the document is easy to read, but finding some talking heads to just talk to the key issues, I think would be, proper Nottinghamshire people talking to these issues would be social media and on our website.
You cut off there, Mike, but I think, I'd agree entirely. Matt, I think that's a good idea, actually, isn't it? We get some citizens, residents, whatever you want to call them, don't necessarily have to be officers of the county council, just to come and bring on board what work we're doing in conjunction with these other groups and how it's affected them as people, but might be interesting, and how they want to move forward as well. So, as Michael says, bringing a more humane element to it, which is what I tried to get in it at the time, and perhaps went too far over the wrong way in that. But I was doing it, I hope, for the right reasons. I think the officers were as well. Does that make sense, Matt? Would that be able to be something that you can try and work on board?
Yeah, we could definitely do that, Chair. No problem.
Thank you for that suggestion, Michael. Anybody else, please, before I move to the vote? Okay, so you've seen the recommendations there.
Kate.
Oh, sorry, Kate. Beg your pardon, Kate.
I just want to very briefly say that last week I had a letter from Grant Chat saying the Midland Main Line electrification looks as if it's on course. They haven't given the timescale for that, but they are committed to doing it. So I think that's good news.
Thank you, Kate. Recommendation 1 is approve the Economic Recovery Action Plan, which will be subject to ongoing review. And we've already discussed that, I think, and then agree to support the delivery plans aligned with the Council's policy response to COVID-19. You can see there 1 and 2. Keith, would you like to read out the names again, please?
Yes, I will, Chair. So starting with Councillor Reg Adair.
4.
And Councillor Joyce Bosniak.
4.
Councillor Ben Bradley.
4.
Councillor Mrs Kay Cutts.
4.
Councillor Stephen Garner.
4.
Councillor John Knight.
4.
Councillor Rachel Madden.
Against.
Councillor Michael Payne.
4.
And Councillor Alan Rhodes.
4.
Thank you. So that vote was carried 8 votes for, 1 vote against.
Okay, thank you very much. So you can see the agenda item 8 is just the work programme. Any amendments, any additions, anything anybody's not comfortable with? Bearing in mind that I take the point on board about the local government reform criticisms that were made by Labour members. Anything anybody wants to add, take off? Well, there's no need for a formal vote on that if everybody's happy. So with that, I'd like to thank you all for what I think has been a good meeting again, and we'll close the meeting. Thank you very much.
Thank you.
Thank you, Chair.